completely, wholesomely responsible for another human being's life from the time they're sleeping, they're waking up, what they're eating, to clean them up, to take care of their medical needs. And that was overwhelming. I thought I was not prepared for this role. I was fortunate enough to be in Massachusetts, Worcester, Massachusetts to be precise, in the vicinity of University of Massachusetts. Dr. John Kibitson, who's a renowned physician, but also a very renowned mindfulness teacher, had started an 8-week mindfulness-based stress reduction program, which he had used on patients and healthcare providers and anybody. And I gravitated towards learning more about that. I remember I enrolled into the program and learned about how these practices can help me. That was one of the skills that I put in my toolkit to use it for later. Sorry. Click it again. Sorry. Yeah, thank you. And this is here, I'm practicing some of the mindfulness skills with my family. Moving on, I moved from Massachusetts to Arizona. And I was practicing as an internist, expecting our second child, and I was diagnosed with gestational diabetes. I was not prepared. As a young, healthy individual who always thought that I was making my life decisions in the right way, being active, eating right, doing right, I was not ready to take blood sugars 4 times a day, taking insulin twice a day, and managing my carbs and counting my carbs. But here I was doing it. And at that time in my life, I came across a coaching tool. I was listening to podcasts and I came across this physician. She was a life coach and she was teaching about weight loss. But I was still pregnant. I was not interested in weight loss. But what I learned from that is the tool that she was using and that I certified later to use it on myself and many more times. And I realized that sometimes you need a coach. A coach for me, I did not have a professional coach helping me out. This was just a part of me behaving as a coach. When I was down there, struggling and overwhelmed with this new diagnosis of gestational diabetes, I felt that I could use these skills. And this is like a coach, like a person who's pulling me out from the deep.
Welcome back, Delta. To get you to the right place, what can I help you with today?
I'm trying to make a reservation.
Yeah. So this was this helping hand that I had who was trying to pull me out from the deep end of the pool. I also felt these skills that I was using made me more aware of my thoughts and my belief systems. And then the biggest thing, I thought these tools made me more aware of my accomplishments and my applauds that we often forget. We are often in the hamster wheel of working hard. We move from goal to goal and we forget to pat our backs. So I was really amused with these toolkits. I remember before I was using any of this, the main narrative that I had in my mind was, I'm not good enough. I would look out to people and think they are perfect, feel lonely, feel isolated, just not good. I felt like a failure. But I slowly realized the awareness that these tools applied to me and how I transformed and how I could get rid of that baggage behind my back and flourish as a physician, as a mother, and as a human being. So that was my story. And I would always get people to ask me, you look too happy to be a mother of 2 and a working professional. But I was this happy person who was doing well most of the days, having my struggles on the others. So my question was, if it works for me, will it work for everybody else? And then what did I do? Went on Google. And here I found a lot of studies showing that coaching, mindfulness, and these kind of practices were really working. People were using them in residency programs, people were using them personally, and they were making headways. I'm not here to talk about numbers. I'm a problem solver. I like to pass on skill sets. So everybody knows that physician burnout is expensive. It costs us lives. It costs us money. It costs us quality of care for patients. And I was ready to pass on these skill sets to the next generation. So this is the coaching model that we're going to talk about that I use multiple times during my day at work and at home. This coaching model consists of 5 parts. The mnemonic is CTFAR. The C, which stands for circumstance. What is a circumstance? Circumstance is a neutral entity which can be proven in the court of law. So I'm a physician, I can do my genetic testing, I can show up my MD degree, and I can prove that I'm a female physician. An act of nature, a hurricane, a landslide, an earthquake that happened, it's a neutral. It can be proven that there was this natural calamity that happened. And the interesting thing is, there could be people who could think positive things about it and negative. The next component of the model is a T, which is the thought. So in a day, there are about 40,000 thoughts that comes to our mind. The moment I talk about a circumstance, there would be a thought that would pop up in your mind. If I say I'm a female physician and you have met people who are really accomplished female physicians, you would be like, wow, that's good for you. You've done well. But then if you've seen people struggling who are females and physicians with their family and professional life, then we're like, oh, wow, that must be hard. So the next thing that pops up the moment we come across a circumstance is thought. I also generally like to talk about beliefs here. So beliefs are nothing but thoughts that we think often. Like we hear from people, oh, I'm not good with maps. Oh, it's difficult for me to lose weight. I am this, something that we have thought of multiple times. And I really reach out to the principle of neuroplasticity here. If we have gone through a thought multiple times in our minds, it's just easy to access. So our brains do the easy part. It just reaches out for that thought and just access that thought. The next part of that model is F, the feeling. In a group of 100 people, if I ask what is their life goal, at the end of the day, I get most of the times to answer happiness and peace. So whatever we are doing in our lives, the goal is a feeling. If I'm wanting to be an accomplished physician, I want to be happy with my accomplishment. If I want to have family time, I want to be happy. If I want to take care of my patient, I want to have peace at the end of the day. So most of our actions will always focus towards a feeling. And it is a body sensation that we feel, which, like I said, motivates most of our action. So the next component of the model is action or inaction. It's self-explanatory. The reason I said inaction, if we have a goal in mind and we have a format, we've designed a plan, but we don't follow through, we're not going to reach to that goal. So the inaction plays an important part to the results that we see, which is the next part of the model, which is the result. The very interesting thing here to notice is the results are most of the time a portrayal of our thoughts. I know it's just different. We expect it to be a portrayal of our circumstance. We expect it to be a portrayal of our feelings. But most of the time, the thought is kind of the part of the model that really moves the model. So how are we going to use this model? We can start using the model from any part. So say today I'm feeling frustrated. I can plug in the feeling and go to what is the thought? What am I thinking myself at that I'm feeling frustrated? What am I doing when I'm frustrated? And then we could go up and down either ways on the model. I'm going to give a common model. I'm expecting most of us are either, medical students, physicians, or, some kind of attending here. So I'm going to use a common model that applies to most of us. So all of us were pre-med students at one point. Our thought was, I want to be a physician. Our feeling, we all felt motivated. The action, we worked hard. We gave our MCATs. We applied for medical school. We finished our USMLEs. We applied for residency. And the result, we are all accomplished physicians today. At this point, I want to see if there are any questions in the audience.
Those of you online on Zoom, you are welcome to unmute yourself to ask a question as well.
Okay. So moving forward, when I was talking about the neuroplasticity or the belief system of our thoughts, sometimes it is called the unintentional model. It's the default of the brain that it offers the same thought again and again, but because we've been there multiple times. And the coaching models sometimes help us be aware of those thoughts and see if there is anything that we want to change and how we can go from an unintentional model to an intentional model. So here I'm going to talk about how we can shift that thought process from an unintentional process to an intentional process. We've all been through the pandemic, and we've all talked a lot about the pandemic. But here we're going to talk about how the pandemic was a circumstance. It happened. My thought was, I cannot do this anymore. I was tired. The feeling, overwhelmed. Personally, professionally, I was done. I was just overwhelmed. The action, I was not showing up 100%. I was not showing up as a mother. I was not showing up as a physician. I was not showing up as a colleague. I was making errors. I was trying to multitask, juggle too many roles. I was just overwhelmed. The result, burnout. Most of us have faced this in some form or the other. So this is the default model or the unintentional model. And I'm going to take the liberty here and just present you what my thought was and how I could change a little bit. It might not work for everybody, and it might not work every day, but it's just a thought. And we'll see how that works. So the COVID pandemic was still the same. And I'm just using one of these skill sets that I have gained over years and see if that thought that I cannot do this anymore gets replaced by I will try to do my best today. Just today, just in this moment, I would do something that I'm proud of, that I showed up 100%. And we're not talking about long term. We're just talking about right now, a thought that I could believe. I could believe that I can show up 100% right now. The feeling, I get some hope. The action, I show up as myself, my best version possible in that moment. I do have baggages. I do have other responsibility. I'm multitasking. But if I am with a patient, they have my 100% attention with whatever possible attention I can provide them. And the result was that I developed some resilience. And like I pointed out when we were talking about the model, that the result would kindly depend on the thought. And the shift might not be as remarkable. Like I said, I took the liberty to go over and skip various models that come in between. The shift might not be this big, but it could be small steps towards the goal that we would want to achieve. So the result of burnout to developing some resilience could be just a thought. We could start with a thought. Now, let's talk about some of the day-to-day things that we all see. So in my clinical practice, and these are all real patients that we have come across, and I'm sure all of us have some similarity or stories which are similar. I came across a 75-year-old male patient who had COVID pneumonia with other comorbidities. He was on high flow nasal cannula, BiPAP for more than 15 days, but he'd made a choice. He does not want to get intubated. He's saying his final goodbyes. His family is around me, but he's also appreciative of the service I've provided. And I'm there for him, completely present in that moment. Next day, I see a patient, 39-year-old female, came in with abdominal pain, distension, diagnosis, metastatic cancer. She has young kids. She's scared. I see fear in her eyes. I'm there for her. Days goes on. I see more chronic diseases. This was more amplified during the pandemic when we had the regular workload of these chronic problems, but also the patients who were not getting better. And I'm present for all of them. But by the end, I do not have anything to offer. My cup is empty. And let's run the model, that we have talked about, the CTFAR model, the circumstance, thought, feeling, action, and result. So the unintentional model or the default model where I was living, this is all, this is a real model that I was trying to do in my mind. So the circumstance, there is a 75-year-old male who is saying his final goodbyes. There's this 39-year-old female with metastatic disease and more chronic patients with more goodbyes. My thought, I do not have any more to give. I'm tired. That's my feeling. I was just tired. I could not give any more. My cup was empty. My actions, I carry the sadness with me. I remember my family recognizing that and saying, you have to switch off from work, because I would carry that story, the sadness with me even home. And I wish I had a switch on and on, but I did not. I continue to think, how can I help? Did I do enough? Keep reasoning, why? Why are we going through all of this? What's happening? Not being present 100%, personally and professionally. When I was home, I was thinking about the patients, the stories that I had just experienced. Distracted, sometimes making errors, just thinking about those final goodbyes and not being present. Having difficulty moving on and letting go. I was snappy. I was not happy. A lot of self-judgment and critical narrative. The result, I was not there. I was not giving my 100%. And this is where a lot of us were living, including myself. And then I recognized that there could be some change, that I could change some things around it and see what happens. The circumstance still remains the same. We have the 75-year-old, the 39-year-old, more goodbyes and more chronic diseases. My thought, I can try and extend compassion. And this is my aha moment that I want to talk about. I still remember like it was yesterday or right now. I was standing in the ICU with a young patient in his 40s with COVID-19. He's been in the hospital for more than 4 weeks. His wife, his daughter, both were nurses and they were vaccinated. He chose not to get the vaccine. I remember the first question he asked me when I met him for the first time, when can I go home? He was on a couple of liters of oxygen and we all decided, let's see how you do, and then you will. Slowly, he got worse. He decided not to get intubated. He didn't want his family to go through that. He was on the BiPAP, high flow nasal cannula, for almost 4 weeks. The other organs of his body were giving up. And I had seen him 2 weeks out of those 4. And it was my last day on service. And I remember being there with him in that moment. And we had a relationship. He trusted me after all this while and understood that I see him as a person. And I remember there were tears in his eyes, and he said, "I'm scared." And he just cried. He sobbed. I could see fear. I could see shame. I could see guilt. All he could say was, "I wish I could go back and change my decision about the vaccine, but I can't. And now I'm scared." And I was already feeling that I don't have any more to give, and I'm tired. But I was here with him because I wanted to be with him and provide him whatever I could. And in that very moment, I felt like a breakthrough. I remember personally, I was doing a mindfulness course and I was coming across this loving kindness and metta meditation of compassion. And I felt I could not feel what he's going through. I can try and feel his fear. I can try and feel his shame. But what he needs and what I need in this moment is a closure and peaceful moment. And I extended those words of metta, loving kindness. May you be happy. May you be peaceful. May you move ahead in your journey. And I was peaceful. Just being there in that moment for him, it felt I could give everything I had. And it's unique because he felt it too. He felt I wasn't suffering for him. He felt I was peaceful. His fears went away and he said, "I'm fine. I'll be okay." And that was my moment where I felt, rather than feeling their fears and feeling their anxiety, how about I send some loving kindness? How about I extend some compassion? How about I make and say those words, even if they sound small, they might impact them and myself in a different way. And I just did that. Every time now I enter a patient's room, I say those words. And it has changed the way I practice medicine. It has changed the way I show up as a physician. And I just did that. I extended some compassion. My feeling, hope. May you be happy. May you be peaceful. The action, I show up 100% as a physician who's confident to show up in a room, even if the patient is suffering. I support the needs of my patient. I extend compassion. I wish for peace for my patients and myself. I have better mental bandwidth to show up as a physician, to show up as a mother, a friend, a colleague, and all the other roles that I perform in my life. The result, a compassionate physician, a happy experience. So this is the model that I use multiple times during the day. And I like to go back and just reinstate. It's a simple model. A lot of times we would see this model show up in cognitive behavioral therapy, some of spiritual text actually. People have brought that up at multiple occasions, that they feel that some of their spiritual texts speak some things about this model, but just a very intuitive model, I think so, that I could use every day. This model gave me the awareness that these thoughts that come up in my brain could actually impact the quality of life I live. And that's when I moved towards mindfulness. I'll open up for some questions if anybody has.
Dr. Gupta, I see one on the chat right now. Does this model work for you at home as well as in your practice?
All the time. I have young kids and I use this model all the time. When I'm coming back from home and it's like, it just behaves like a check-in. And I have a kid, I have a kid who's throwing a tantrum and I get upset. I start with the feeling. Oh, why am I feeling upset? And most of the time, that upset feeling or the feeling of frustration is not coming from the kid or this interaction. It's coming from my experience, what has been at work. And I can go back to that circumstance that is making me feel frustrated or angry, and then resituate myself into the moment of being a mother. So in relationships, be it your spouse, be it your siblings, be it your parents, I use this model all the time. Either you could use the unintentional model to check in what's happening, or you could go to an intentional model to put the result as a goal. Like, I want to have a successful relationship with my spouse. That would be my goal. And I could move back to the action. How would I want that relationship to look like? Be it your spouse, be it your sibling. And then you could come up with action. I want to show up 100%. I want to be there. I want to spend quality time. I want to go on dinners. I want to have a conversation once a week with my parents. I want to go on a holiday with my parents or sibling. You could have action points. You could have the thought, so you could start anywhere, but I use this model personally and professionally all the time, multiple times during a day. The best way to use this model is to write down. I know we sometimes think we can do it all mentally, but once we use the power of pen and paper, the magic shows up more. So yeah, it's really beautiful to start writing down some of these main models, and then you would be sometimes able to pick up a thought. Like for me, it was really, I am not good enough. And I'm not there that I'm done with that thought. That thought still shows up multiple times during the day. But I can identify that thought before the whole models run through and offer my brain, I know you're trying to offer me a thought, I'm not good enough, but I'm not ready to take that thought and go ahead right now. So let's halt here. And then I have noticed that, and we'll talk about mindfulness now, that if you extend some love to the thought, maybe that thought diffuses and transforms into something else. So yeah, I use that model multiple times during my day. So that was one of the skill sets that I use. And like I said, that coaching skill set really made me aware of my thoughts. Like I said, I was able to pick up a common theme for myself, which was I'm not good enough. And I'm sure, we could have multiple themes for ourselves, and we could identify those themes. And then I really wanted to build up on those themes and see how I can move forward. The interesting thing was, I could not replace that thought, I'm not good enough, to I'm great. It's like you can't make a crying baby smile and just put a smile on their face. It has to be a believable, replaceable thought. So I'm not good enough went to something which is more acceptable. I can try to be better. Or something that is more acceptable to you. And that could be, I would give it my 100% today. Or in this moment, I'm going to be present. Or something that resonates with you so that it generates the feeling that you're looking for. For me, it was, I'm going to try. I have done big things in life, and I'm going to try to do this one as well. And slowly, you will notice the theme or the belief system that you had earlier would transform into something different. And I was always very interested in mindfulness practices. And, we can talk about what mindfulness is and how to go about it. But there are other practices that you could also use. This is just something that worked for me. But for other people, it could be therapy. It could be journaling. It could be running. It could be swimming. It is just one of your activities that you could use to help you just process those thoughts, I believe. That is how I use mindfulness most of the time. So what is mindfulness? It is a mental state which is achieved by focusing one's awareness on the present moment while calmly acknowledging and accepting one feeling, thought, and bodily sensations. So just the awareness of those thoughts. And that is where I was coming from. I was aware that I had a lot of thoughts and belief system, and I wanted to work through my way it. I came across, I know I'm interested in some mnemonics. I go them and gravitate towards them because I think it's just easier in medical school how we learn mnemonics and diseases. It just becomes easier for me to process them and use them and reach for them when I'm going through a personal moment. So this RAIN technique was initially started more than 20 years ago. And we would go over what this mnemonic means now. But Tara Brach, she's a mindfulness teacher, and she has really incorporated and used this mindfulness technique and now really talks about it and writes about it. So the R in RAIN starts with recognizing the emotion that we are having. So for me, it was recognizing my empathy fatigue at that moment with that patient. Like I was done giving in more. I didn't have more. And then allowing that emotion to surface. Once you have an emotion, and if you try to suppress that emotion, it actually behaves just like a beach ball. You can take a big beach ball and trying to push it down in a pool of water, and it's not going to go down. It's going to bounce back with more force. But if you let it just be on the surface, it's going to do its own thing. It's going to be fine. It's going to just be there. So allowing that emotion and just giving it space. And then I stands for investigating. What is this emotion telling us to do? What is it trying to do or helping us with? And the N is nurture or non-identify. I know we, as physicians, we talk a lot about, you don't say, I am depressed. This is depression. I am sad. I'm feeling sadness, or this is sadness. And how that would make you separate from the emotion. Because if I am depressed, the whole of me is depressed. But if there is depression, there could be hope, there could be happiness, there could be peace as well. So just nurturing that emotion and not identifying with that emotion. So that is the RAIN technique. I want to take liberty and actually go through a small mindfulness exercise with everybody and see what comes up. So if you want, you can take the theme that we were talking about, going through a lot of empathy, or if there is any other emotion that comes up for you, feel free to kind of bring that emotion to surface, and let's see how it works out. So I'm going to use my phone bell as a meditation bell. And we'll try and do a short mindfulness exercise and see how that goes. So if you're driving, don't do this. I know it's a virtual world now. But if you're not and you can participate in this exercise, you can close your eyes if you feel comfortable, or lower your gaze and sit in a comfortable posture. If you're sitting, you can plant your feet on the floor, your hands relax, and close your eyes. Take some deep breath, some big cleansing breath here. Helping you arrive in the moment. Try to straighten your back, not too straight, but elongate your spine so that you're alert. And let your breathing drift to its normal rhythm. As we go through this exercise, I would try and go through the RAIN model or the RAIN technique, where we recognize the emotion and also at the end, extend some compassion if you're going through a difficult moment or otherwise, and then finish off with some breathing. Noticing where you can feel your breath the most, whether it's your nostril, your chest, your abdomen, and just being there for a few breaths. This is mindfulness of breath. And you might notice your thoughts wandering. At the moment you think of coming back to the breath, that is your moment of awareness. Trying to resurface an emotion that you're feeling right now. And if you're feeling none, that's okay. You can still follow through. Recognizing what emotion is this, whether it's overwhelm, fear, anger, sadness. Where can you feel it in your body? It's your chest, your face, your hand, your heart, or your belly. And just spending some time with your emotion. Making space and allowing that emotion to surface. It's okay to be there, respecting that emotion and allowing it to exist. Once you've made some space for the emotion, investigating, why are you feeling this? Where are you feeling this? Having curiosity, but holding compassion for the emotion and for yourself. And nurturing that emotion, understanding that emotion is there to help you and protect you. And recognizing this is the emotion. This is the fear. This is the sadness. And not saying, I am sad or I am scared. This is sadness. This is frustration. Now, once you have that emotion, extending some compassion towards it. There are some traditional phrases that we use in loving kindness meditation. You could use those or come up with your own. May I be happy. May I be healthy. May I be peaceful. And saying these words as you really mean them. May I be happy. May I be peaceful. May I be healthy. Noticing if there is a change in the way you feel before you started this exercise versus now. Letting go of that emotion if you were still holding it, or compassion, and moving to your breath. And when you're ready, open your eyes and be aware of your surroundings. To recap the technique that we just used, the RAIN technique, the R for recognizing, the A for allowing, I to investigate, and the N for nurturing or non-identify. Before we move to the take-home points, I promised that I would talk about some diagnostic and troubleshooting tools. Every time we're using a computer or a hardware device, and there's a problem, I remember going to the section troubleshoot. And I remember, and I try to reach out for these skill sets when I have to troubleshoot in my personal and professional life. So like I mentioned, mindfulness and coaching are my toolkits to go to. It could be different for you. There are a lot of other tools out there which you could incorporate in your personal, professional life. But I would always encourage you to reach out for those tool sets for troubleshooting so that you could have a long, productive career in life. Now, some takeaway points. All the circumstances we talked about are neutral. It's the thoughts that makes the result. Mindfulness can make you aware of your thoughts, and extending some compassion could prevent compassion or empathy fatigue. Some resources that I reach out for. The second one is not a weight loss podcast, but that is the podcast that I was listening to when I had the transformation myself. So I felt that I should mention it. Some other podcasts that people or I could reach out for. There are some apps that I use to, use mindfulness exercises. Some of them are free, some are paid subscriptions. Some authors that I reach out for when I want to read some more and improve or increase my tool sets or skill sets. And the first one is the 8-week MBSR course at University of Massachusetts, and some other websites where they have different courses. Open up for questions again.
We do have some from some Zoom listeners. So let me start with this one. Do you ever use the RAIN technique or the circumstance thought model with each other, or are they completely separate when you're thinking about both of those techniques?
So I actually always use them. In my mind, that is the magical way I use them always. And for me, the coaching technique was more objective. I could run through a model on paper and be like, oh, this is the feeling that I have right now. But like I explained, I could not replace that feeling right away. Like that feeling was there and I had the awareness of that feeling. But what do I do with it? And then I could recognize that there is an emotion and allow that emotion to be. So I actually use those techniques together all the time. All the time. Yeah. I would allow that emotion to exist if I've noted an emotion, and then just nurture it with some more compassion and see how that transformation happens.
Thank you for that. That makes more sense. And I hope that answered their question. Another question we have is, do you ever use guided meditation with patients, and has that been successful? It was a very peaceful few minutes, and I wonder if patients encourage that, or you encourage that with patients.
I have personally not used guided meditation with patients. I have coached them multiple times, them knowing and unknowing both ways. But I know people. I worked with a social worker, and I'm working with her right now. Shout out to Laurie if you're listening, Laurie. She uses sometimes, I think, imagery and guided meditation for pain comfort. And I know other people who have used guided meditation. I just have not had that interaction with a patient where I could use guided meditation. But I would totally do it if somebody was up for it.
We do have another question online, but is there any questions for the live audience? Okay, then I'll go ahead and ask this last question. Do you use any of these techniques or teach these techniques to your children? And how young is too young to have them start using it?
Oh, they reach out for these techniques all the time. My 2-year-old was able to do breathing probably before that, but I remember as a 2-year-old, they were easily able to do breathing and deep breaths. And there is a technique in mindfulness called naming, which is just recognizing the emotion. So my daughter really struggles with some anxiety, and I've had children or noticed children who struggle with anxiety or other difficult emotions. And sometimes just naming that emotion is really helpful. So I will have them name, and I would use or encourage them, use words. What are you feeling? And they would come up, oh, I'm feeling scared. What are you feeling scared of? Oh, that you would not come back on time. Why do you think that? You know, if mom won't come on time, dad would be able to come on time. Yeah, I think so. That would be possible. And then just talk about those emotions that they are feeling. And now I have noticed with years of practice, they can name their emotion way faster. So I do use them a lot with my children. Coaching, I use them personally to help me and them have a better experience. But mindfulness, they do a lot of stuff with belly breathing. The way the kids do breathing is you put your hand on the belly and you make them see the fall or feel the fall and the rise. And that helps them really having a good moment. And then sometimes I would put their hand on the chest and make them feel their heartbeat. Just feeling of the body sensations make them come back in the present moment. And that applies to us as well, adults. So sometimes if we are just having a moment of anxiety or panic, I would just start feeling my hand or just, have my hand on the heart if that's possible. And then just the feeling of body sensations make you come back to the present. So I do use them a lot with my children as well. Yeah. Anything else? This is what we were talking about. These are my 3 children. And yeah, let's just practice together with more skill sets and more tools that we can have with us to have a beautiful and productive and happy lives. And this is the CME credit that we can reach out for. And this is my email address if anybody wants to reach out. Thank you. It was great pleasure being here.